Think you're eating well? You might be overlooking some silent saboteurs. Hidden nutrient gaps like iodine, crucial for thyroid. Magnesium, for sleep and muscles. Selenium, heart and immune support. Folate, energy and pregnancy health. And omega-3 fats, brain and anti-inflammatory, often lurk beneath the radar. These deficiencies can sneak up as fatigue, low mood, muscle cramps, or even impaired thinking. Yet a simple blood test or diet tweak can turn things around. Let's shine a light on the 5 nutrient deficiencies you didn't know you had. Today we will talk about 5 nutrient deficiencies you didn't know you had. So before we start, make sure to hit the like button and subscribe to my channel. 1. Iron deficiency. More than just anemia. Iron deficiency is the most common nutrient shortage worldwide, affecting more than 25% of people globally, with particularly high prevalence among children, menstruating women, and pregnant individuals. This mineral plays a central role in hemoglobin production, the protein in red blood cells responsible for oxygen transport. Without sufficient iron, oxygen delivery falters, leading to fatigue, reduced physical performance, pale skin, cold extremities, cognitive deficits, and increased infection risk. Despite it being widespread, iron deficiency often flies under the radar. Early stages may present vague symptoms like low energy, irritability, and brain fog, easily attributed to stress or sleep deprivation. Left unaddressed, it can progress to iron deficiency anemia, characterized by dyspnea, palpitations, and in severe cases, heart complications. In children, it can impair neurodevelopment and even contribute to behavioral issues. Dietary sources include red meat, liver, spinach, legumes, and fortified grains. However, absorption is influenced by other dietary elements. Vitamin C enhances uptake of non-heme iron, while phytates in grains/legumes, calcium, and polyphenols in tea/coffee inhibit it. Given the high prevalence of iron shortage, 25 to 47% among young women, the CDC recommends routine screening in at-risk populations. Treatment often requires several months of oral supplements, ideally taken with vitamin C-rich foods. But beware, excess iron can be toxic and should only be taken under medical supervision. 2. Iodine deficiency. The silent threat to thyroid function. Think iodine is obsolete? Think again. Approximately 1/3 of the global population are iodine insufficient, making it a significant but under-recognized nutrient deficiency. Iodine is critical for thyroid hormone synthesis, T3 and T4, which regulate metabolism, growth, brain development, and bone health. Insufficient intake can result in goiter, enlargement of the thyroid gland, as it struggles to compensate. In adults, iodine scarcity can manifest subtly. Unexpected weight changes, fatigue, dry skin, cold intolerance, and lingering cognitive sluggishness. Among pregnant and breastfeeding individuals, deficiency poses grave risks. Congenital hypothyroidism, growth stunting, lower IQ, and developmental disorders in children. Globally, iodine deficiency is the leading preventable cause of intellectual disability. To prevent this, many countries adopted iodized salt programs, which have dramatically lowered deficiency rates. Natural sources include seafood, especially seaweed, dairy, and eggs. However, moves to reduce salt consumption and rising intake of processed foods devoid of iodized salt have led to resurgence in deficiency, especially where food is grown in iodine-depleted soils, like mountainous regions. Women of childbearing age and those with thyroid disorders are particularly at risk and should consider monitoring their iodine intake through diet or supplements. 3. Magnesium deficiency. The underestimated mineral. Magnesium doesn't grab headlines, but it's essential for over 300 enzymatic reactions, including energy production, ATP, muscle and nerve function, protein synthesis, and bone health, making it pivotal to metabolism and well-being. Yet around 50 to 60% of adults in the U.S. don't meet the recommended intake. Deficiency, referred to as hypomagnesemia, surfaces when serum levels drop below 0.6 mol/L, and is common among people with gastrointestinal disorders, diabetes, alcohol dependence, and those using medications like diuretics or proton pump inhibitors. Symptoms can be both subtle and serious. Mild shortages may cause fatigue, muscle cramps, insomnia, irritability, and migraine headaches. Severe cases can lead to tremors, seizures, heart rhythm irregularities, hypocalcemia, and hypokalemia due to disrupted balance of other electrolytes, and in extreme scenarios, coma or death. Additionally, Magnesium deficiency impairs insulin sensitivity, contributing to metabolic syndrome and type 2 diabetes. Rich dietary sources include leafy greens, nuts, seeds, whole grains, legumes, and certain fish. However, modern agricultural and food processing methods deplete magnesium in many products. People with risk factors, or those experiencing chronic fatigue, cramps, or sleep disturbances, should get serum magnesium checked and possibly supplement under medical guidance, typically with magnesium citrate or glycinate. Restoring magnesium levels improves sleep quality, reduces cramps and migraines, and supports blood sugar and blood pressure control. 4. Folate deficiency. Beyond pregnancy health. When most people think of folate, vitamin B9, they think of pregnancy. But its importance spans all ages. Folate is vital for DNA synthesis, red blood cell formation, and neural health. Despite folate fortification programs, deficiency remains widespread, especially among those with poor diets, heavy alcohol use, gastrointestinal issues like celiac or Crohn's, or taking certain medications. While severe deficiency is rare, even mild shortages can impact DNA synthesis, leading to anemia and impaired cell division. Clinically, folate deficiency manifests as megaloblastic anemia, marked by large immature red blood cells, which presents as fatigue, weakness, irritability, heart palpitations, shortness of breath, pale or jaundiced skin, glossitis, tongue sores, and sometimes behavioral or mood disturbances. Left untreated, it can impair immune function and wound healing. During pregnancy, insufficient folate increases risk of neural tube defects such as spina bifida and anencephaly. Sources include leafy green vegetables, legumes, citrus fruits, liver, and fortified grains. Adults typically need 400 of daily, but many struggle to get enough, even in developed countries. Women of childbearing age are advised to take supplements, 400 to 800 of daily, to ensure neural tube prevention. Diagnosis is confirmed by serum or red cell folate levels. Treatment quickly restores blood levels, alleviates anemia, and supports overall health. 5. Omega-3 and selenium deficiencies. A 2-for-1 sneak attack. Omega-3 fatty acids. These essential polyunsaturated fats, EPA, DHA, ALA, are crucial for brain, heart, eyes, skin, and cell membrane health. Humans cannot efficiently convert ALA to EPA/DHA, making dietary intake of fatty fish, salmon, mackerel, algae, flax seeds, chia, and walnuts essential. Deficiency signs include dry skin, poor wound healing, increased inflammation, fatigue, depression, impaired concentration, and even immune weakness. B. Selenium. Selenium is a trace mineral integral to thyroid hormone metabolism and antioxidant defense via selenoproteins. Deficiency is rare in well-nourished individuals but prevalent in regions with selenium-poor soils. Suboptimal selenium impairs conversion of T4 to active T3, contributing to hypothyroidism, fatigue, mental slowing, goiter, mood instability, and in severe cases, reproductive issues, compromised immunity, and heart disease. Though rare, deficiency can lead to Keshan disease, a cardiomyopathy, and Kashenbeck disease, an osteoarthropathy, especially where diets are deficient and viral infections present. Dietary selenium comes from Brazil nuts, seafood, meats, eggs, and whole grains. If you like this video and would like to see more like it, please give it the thumbs up. Leave a comment and click the button to subscribe.